Good afternoon. Today, the Province of Ontario confirmed that the age eligibility at Toronto vaccine sites will be lowered to 60 years old starting Friday at 8 a.m. Anyone born in 1961 or earlier will be able to register to get vaccinated at any of the city-operated sites. I want to thank Premier Ford, Health Minister Elliott, and the Government of Ontario for their timely response to this request made by me and by the City of Toronto by our Medical Officer of Health. I encourage every resident who is eligible to get vaccinated and to do it this Easter weekend if you can. Our clinics are open throughout the Easter weekend and appointments are available. Thank you to the thousands of people who have answered the call to sign up throughout this week, and thank you to all those family and friends who are helping to get their loved ones to get to the vaccination sites and to get their shot. Whether that involves reminders and nudges to get registered, helping them sign up online or by phone, or even accompanying them to the appointment, helping people get their vaccine, especially people who are a bit older, is one of the best things you can do right now to help fight the pandemic. So thank you again to everyone involved in this effort. Today, Premier Ford announced a province-wide emergency break in order to stop the spread of COVID-19. As Mayor of Toronto, I believe this province-wide break was the right thing to do for the Premier and for his Cabinet. In the face of a third wave and the variants of concern, public health officials have been clear that decisive action was needed. I have certainly been witness to these concerns coming from our own Medical Officer of Health. I support the measures that the Government of Ontario announced today because they will help to save lives, and they will, if we all do our part, allow us to get through this wave, to get more people vaccinated and get back to the careful reopening path that we were on. This province-wide action, that scope, is needed in order to have an impact. As you know, I had advocated for consistency and for a province-wide approach, and I think a province-wide approach that achieves that avoids confusion and helps us all to fight this virus. Our city has been locked down for several months, but we are not an island, and we cannot hold back on COVID-19 alone, by ourselves. I know everyone is tired, and I know everyone is frustrated, but we cannot give up on this fight, especially not now, after all that we've been through. With ICUs at their highest occupancy in the entire pandemic, younger people getting sick faster and ending up in the ICU, the health system straining, we cannot logically or sensibly conclude that the status quo was a viable option. We cannot just let the third wave crash over us and react with a shrug of the shoulders. Right now, we all need to continue to keep our distance from each other, to wear masks, and to stick just to the people that we live with. I know this decision will once again be very hard on businesses, some in particular. Patios in our city just opened, and now they will have to close again. Other businesses have been closed for a long time already. No one wanted this to happen, but we cannot ignore the warnings from the public health officials. We cannot ignore the facts as they exist with respect to ICUs and hospitals and people getting sick. I will continue to push the Government of Canada to do as they have done, which is to provide direct financial support to businesses impacted by health measures. And they've been very responsive in this regard, and there's a need to continue to do so. And we will continue to ramp up the city's vaccination efforts as much as supply from the other governments allow, because this is one of our most potent weapons in the fight against COVID-19. I welcome the fact that today the province announced vaccines will be available at 52 additional pharmacies in the City of Toronto. This responds to a request made by myself and Toronto Public Health that the vaccine be available at more pharmacies in the city, particularly in the northwest and northeast areas of the city where COVID-19 has hit particularly hard. With the provincial measures coming into effect on Saturday, along with our ongoing public health response, we have taken the following action. First, I have urged our parks officials and others to redouble efforts to make sure that our outdoor spaces and the usual spring cleaning effort that goes with those outdoor spaces, those efforts are advanced as much as possible this month, recognizing there will likely be more people out and about in the parks during the month of April given these developments. Second, I've asked Chief Raymer to continue to have a more relaxed parking enforcement, as the police have done through much of the pandemic. This is his decision to make as the head of law enforcement in our city. Officers can still ticket at their discretion under all times and all arrangements, but this does recognize, if the chief accepts my request, that many people will likely be staying home, for example, more often, and therefore their cars would be in places where they might not ordinarily be during the day. And so I hope the chief, as he has done, will consider this request in terms of the exercise of the discretion of our parking enforcement officers and police officers. Thirdly, I've asked our transportation officials to look again at our Cafe TO plans for May to ensure that we'll do everything possible this month while we are under these new restrictions to make sure that we're ready to help approved Cafe TO patios to pop up as quickly as possible once the 28-day period is over. I'm very happy to report that we have literally received hundreds of applications for on-street patios in our first round of registration that closed late last month. And staff are reviewing those right now, and I hope we can do that as expeditiously as possible. Our objective is to get them in place as soon as possible, so at what I hope is the successful end of this shutdown, we will be able to have these available to businesses so they can begin the long road to recovery, and to customers as soon as possibly can be the case. Fourthly, I've also asked for active TO plans to be fast-tracked as much as possible so that there are some activities beginning in the month of April. We created active TO during the spring of last year's part of this pandemic so that there were additional places outside for people to get out and exercise safely. I want to make sure we have some of those opportunities during the next 28 days. I believe we can get through this month. We can beat back this virus, and we can still have a summer in our city. There's a goal that we can look towards. Beat back the virus, make our city safe again from a health perspective, and still have a summer. That will be my focus over these 4 weeks, and I hope that will be everyone else's focus as well. We need to be united. As I said the other day, we need to be in absolute solidarity with each other and with our city and with the businesses. The best way we can help those businesses that are going to be struggling for a longer period of time is, yes, to patronize them when it comes to takeout and delivery and other things that you can be doing, a lot of it online, but also to follow public health advice so that we can do our part to get to where we need to be at the end of the 28-day period. We need to have a goal. Yes, to save lives. Yes, to keep people healthy. Yes, to get people back to work. But for the sake of our own state of mind, let's have a goal as well to have a summer. And we're only going to have the summer if we band together and get vaccinated. We band as soon as you're able to. We band together and follow public health guidance, and we band together to support each other, including supporting some of our businesses as much as we can that are struggling within the rules, that we help them within the rules. We will continue to watch the virus very closely over the coming days. We talk about it every single day with our medical experts, including our medical officer of health. And we will be reviewing the impact of these measures introduced today with Toronto Public Health and indeed with the province. I am open to any further province-wide measures that may be required, if that is the judgment of those who are helping us to fight off this pandemic and wrestle it to the ground for once and for all. If health conditions warrant another stay-at-home order across the province being considered, I am open to that discussion, speaking only on behalf of Toronto. That's all I can do. I want this to be Toronto's last lockdown. I want it to be Ontario's last lockdown. That will depend on us, and that will depend on continued and increasing vaccine supplies and continued sign-up by people for their vaccinations. We need this to work. We need this to work. We need a summer with more freedom and more businesses open. We need that for the well-being of people's psychology, as I call it, for their just general state of well-being, but also for the state of well-being of the economy. I fully and completely recognize that. But I know, and most people know, I'm confident most people know, that the health situation is the most important thing. We need healthy people. As I've said many times, a healthy economy requires healthy people. A healthy, vibrant, open, fun, prosperous city needs healthy people. These measures are being undertaken. The encouragement to get vaccinated is here because that is what is going to lead us to have healthy people and to have back a healthy, fun, prosperous, caring, wonderful place to live that we know as the City of Toronto. So please, help out by following the public health guidelines, following the rules put in place on this new lockdown and by following the request we've made to get yourselves vaccinated. I thank you very much for your anticipated cooperation. I'm now happy to answer questions.
Thank you, Mayor Tory. We will now take questions from the media. As a reminder, it's one question, one follow-up. Please unmute yourself when we call your name. First up, we have Jennifer Pagliaro from the Star. Go ahead.
Hey, good afternoon, Mayor. Thanks for making yourself available after the announcement. My first question is, you've said multiple times, and you can understand why, that having businesses, open and then close and this back and forth is kind of the worst case scenario, not only for business owners, but just the confusion that it brings for residents. I wonder what went wrong here. It seems clear to me that to have things open and then close doesn't really make much sense. And obviously it's something you wished to have avoided. What is responsible for that? And can you help people understand how we can avoid something like this happening again?
Well, I think the variants, took off at a rate that some people had projected, but you had to look at the reality of what was actually happening out there in order to understand the breadth of the restrictions that now have had to be put in place in order to try and cope with that and to save lives and to save the health of a lot of people, including a lot of young people, people of all ages that are being affected by that. Here in the City of Toronto, and I take no joy in saying this whatsoever, but here in the City of Toronto, the opening and closing syndrome will affect mainly outdoor patios, outdoor dining. Because in the case of many of the other different kinds of businesses, they had remained closed here as part of a modified gray framework zone. And so in that sense, I feel very badly about those in the restaurant business that had opened only now to have to close again. But for many other people in the retail and other kinds of businesses in the City of Toronto, they had remained closed because we were taking such a cautious approach to the reopening, and I'm glad we did. I always felt it was the right thing to do. I always said so, and I think it has provided for less of that kind of disruption in light of what's happened today than might otherwise have been the case.
And earlier we saw the advisors to the province talking about the best case scenario in the modeling projections, but using what they were saying was a stay-at-home order. And when the Premier was asked earlier about the difference between what has been implemented today and a stay-at-home order, we heard from the Minister of Health that this is not going that far. I wonder if you think these measures today do actually go far enough, given that they don't make significant changes to our current modified lockdown in the city.
If you look at the order and the request made by the Government of Ontario today, it does request that people should stay at home except for essentials like groceries and medicine and other kinds of things that they have to do in that regard. I have said that we will here in the City of Toronto, we would do this in any event as we've done throughout, which is to look at the numbers every single day, and that certainly depending on where the numbers sit, say in a few days from now, I'm very open to a discussion of further measures that might be necessary so that we actually get an effective result out of this that doesn't result in a further future lockdown at any point in time, and that we can have a summer. So in that sense, if a provincial stay-at-home order is something that is going to be even more effective, depending on how the numbers go over the next couple of days, I'm open to that discussion, I just think we should do whatever is needed in order to have the greatest effect on the health conditions as we find them.
Thank you, Jennifer. Next up, we have Lorenda Redekop from CBC. Go ahead.
Hi there. Hi, Mayor. This one about vaccinations, we heard from the modeling experts today that people in the hardest hit communities from COVID-19 aren't getting vaccinated as much as those from the lowest hard hit communities across most age groups. What is the city doing to try to boost that in Toronto?
The city is actually doing an extraordinary amount to try and reverse that trend that was evident in the first period of vaccination. I will tell you, for example, that in opening clinics in a couple of those harder hit areas, even this past week, we saw very high usage of those clinics. Those were not places where there were a lot of extra appointments, so that's a first thing. The second thing, we have extensive efforts now fanning out into communities across the city, where we have, I think the number is 280 ambassadors out there, and they're ambassadors in the sense that they're going into the grassroots of those communities hardest hit, if necessary, person by person, because in some cases there's a hesitancy that has to be overcome by building trust and getting people to go and get vaccinated. We've had today, I think as a day, we have 30 clinics, not just the ones you're familiar with that we operate, but there are dozens more that are being operated in other parts of the city, in many cases in areas like that. We provided to the province a list of pharmacies because their list was short on pharmacies that were in some of the hardest hit areas. We gave them a list, and to give them their due, a number of those were added to the pharmacies in the vaccination program today. And so we're doing a lot in that regard and we have extensive programs yet to roll out to make sure that in those hardest hit areas, we do whatever it is we have to do to get to the people or to get them to us to get the needles in those arms. It's a more challenging task, often because of language, sometimes because of vaccine hesitancy. We've had seminars, for example, that have attracted several thousand people to dispel some of the myths about vaccination, which are myths that sometimes are historic in nature, and we've got to deal with that with some of the people that make up our very diverse community. And so we're on that in the sense that it is not acceptable to us to have a situation where you see that kind of disparity in the rate of vaccination, and so we're taking all the steps that we can to reach out to those people and to have them in turn try and reach out to us. We had a town hall meeting last night. We have another one tonight where the Chief Medical Officer of Health, the Chief Peg, and myself all participated in answering questions. 82% of the people at the end of the town hall said they would be likely to go and get vaccinated, and I can assure you the kinds of questions they were asking on the town hall, and I think the media were able to listen to it, were questions that are on the minds of a lot of people about different vaccines and about do people have the right to make this choice or do that or do this, and we've answered those questions, and we will continue to use every means at our disposal, including town hall meetings, including we're going to blast out text messages by phone, which may irritate some, but it's for the greater good. We're going to literally be going door to door. We're going into our Toronto community housing buildings and having clinics in those buildings for the seniors. So we're taking a lot of steps to try and remedy that initial wave, which was something that was just a result. You have to wait a period of time when you start out to sort of see where you're being successful and where you're not, and we certainly know now the places where we have to work harder.
Thanks for that. My follow-up, I've been hearing real concern over the past few days from people who work with the homeless, given that we have, I believe it's up to 17 different shelters and shelter hotels with outbreaks. How do you characterize what we're seeing in terms of outbreaks for that community? And what is the city going to do to reverse this?
Well, congregate settings of all kinds are places where you are more likely to see outbreaks take place. And that's not saying it's excused or that it's a good thing or that it's an acceptable thing, but it's more likely to happen in places like that for the obvious reason because of the way this virus transmits itself back and forth between people. And so we've had some efforts that have resulted in hundreds and hundreds of people in the shelters getting vaccinated. But the key is going to be to continue the efforts we've made, which are huge in nature, to physically distance people. So we've got some 3,000 people that were moved out of shelters into other kinds of accommodation to make sure they're physically distanced. But obviously recognizing we still haven't, wrestled that problem to the ground. The other key to this is going to be vaccination. And we are looking right now at ways in which we can speed up the process of ensuring that homeless shelter residents are vaccinated. It's not a simple task because the people by definition sometimes move from place to place, but we are going to be really redoubling our efforts in the coming days to make sure that we drive up the rate of that vaccination so that it provides that protection to those people as soon as we possibly can. And I think, as usual with every other case, it is the same two tools that are our most powerful and potent tools, namely keeping distance for people and vaccination.
Thank you. Next up, we have Melissa Nakavoli from City News. Go ahead.
Hi, Mayor. So the news from the province is hitting a lot of local businesses really hard. What is your message to these businesses, and what would you like them to know, especially the restaurants with patios that have only been open for a couple of weeks now, and personal care services that had to hire back staff only to let them go again?
The only message I can give them is that we are getting there. The variants have thrown us for a loop. There's no question about that. But we're getting there because we have an increasing level of vaccination. If you look at the situation today in long-term care, where as of yesterday's numbers, there were only literally a couple of dozen cases in the entire long-term care system. And that's a far cry from where we were. So that vaccination has been proven to be helpful there, and that's why we've got to step up the rate of our vaccination. But at the same time, we have to stay the course against now what is a third wave, this one being the variants of concern principally, and we have to follow more or less the same rules, but just follow them in solidarity and strictly and as carefully as we can. Don't socialize with other people you don't live with. Don't be in crowd scenes. Keep your distance from people no matter who they are, unless they are people you live with. Wear your mask. Wash your hands. These are things we've been saying throughout the whole year of the pandemic, but never has it become more important now. And all I can say to businesses, if we support you, we meaning the people of the City of Toronto, all of us, without exception, in complete solidarity, by doing that, staying home, celebrating the holidays, Passover, Easter, Ramadan, and so on, with our own families only, wearing masks as often as we possibly can, getting vaccinated, washing hands. If we do those things, every single one of the 3 million people do it, then those businesses will be back open again much sooner than if we don't. And if we want to have a summer, which I think we all do for a whole bunch of reasons relating to our state of well-being and our mindset after all this incredibly frustrating and agonizing time for business and just for people, then that's what has to happen here. There is no other magic answer. If you look at all the countries in Europe, pretty well without exception, they've all gone through these kind of waves of different things they've had to do with regard to restrictions and so on as they've faced new enemies and new threats. And this variant of concern is a new threat, relatively new, in the 1 year period. And I will also tell the businesses that as sorry as I am that this is happening, I believe it is the right thing to do in their long-term interest, because a healthy economy does require healthy people. They need healthy employees. They need healthy customers. We need healthy business owners. And if those people are getting sick in unacceptable numbers, we're not going to have any kind of an economy that is going to function properly. And this is going to go on and on and on. We'll be standing here talking about this at Christmas time. And the objective is not to be doing that. And so the other thing I'll tell them is that I will fight hard if there are programs that are going to be expiring or that need amendment or modification in order to provide more support. I will fight for that, because these are innocent victims of COVID-19, among the many innocent victims, humans and businesses and otherwise, and we've got to try and help them all as we've been trying to do.
That's good for me. Thank you.
And then last, we have Kevin Connor from the Toronto Sun. Kevin? If you can unmute yourself if you have a question. Okay, I think, Bill, you have questions too from Global. Oh, in the mic, please, Bill. Thanks.
Thank you. Mayor Tory, on a much lighter note, but still a pressing issue. When are you going to get a haircut? We're now closed for another 4 weeks.
People will have to observe the evolution of my hair, such as it is, for another 4 weeks, because I will get a haircut when the rules permit me to do so. This is, look, I'm sure I could go and take the scissors and do some things to my own hair, which wouldn't be a pretty sight. I could ask, a member of my family, my wife or somebody else to do it. But, I'm respectful of the fact that I ask a professional to cut my hair for a reason, because I want it to look reasonable and because they know what they're doing, which I don't, and frankly, nobody else in my family knows how to do that. I just want to focus on getting those people back in business, back to work, back open as soon as possible. And I think if we all cooperate, one of the other benefits beyond the much more important ones of us being healthy and of healthy people fueling a healthy economy and of people enjoying the summer, one of the other benefits will people won't have to look at me with this hair, although there are people who write to me and say they think it looks better. I'm not sure what they think that looked like before, but so I'll get a haircut when the rules permit, and that will be at least 4 weeks from now, and I hope it is 4 weeks from now to the day. Okay.
Oh, just one more. We're just going to try Kevin one more time. Kevin, if you have a question, please unmute yourself. Okay, it seems like Kevin doesn't. So that's it for today, everybody. Thank you. Have a great
Thank you very
long
much.
weekend.